And welcome back. I'm Mabel, Jong. You're watching WHCC TV. And we've seen a surge of M&A activity in the healthcare sector in recent years. Our next guest is involved with that. Please welcome Patrick Allen, Principal Business Consulting at EPAM.
Hey Mabel,
nice to see you, Patrick. Tell me a little bit about EPAM and where you're based and what sort of work you do.
Sure. So EPAM is a consulting and engineering firm. And we help our clients achieve their goals by building and implementing technology solutions. We're based in Philadelphia, Pennsylvania.
Okay, and we, as I mentioned, have seen a surge of M&A activity, a lot of partnerships as well. Do you expect this to continue?
I do expect it to continue, perhaps at a slightly slower rate than we've seen in the past. There's been a number of articles and information that have come out recently showing how M&A activity is definitely continuing, but it is slowing down slightly.
And what is your advice to companies who are interested in doing this? How do they navigate the field?
Sure. You know, I think there's a couple of really important things. The first is to make sure that you understand and clearly articulate the strategic goals and the business case for the merger. It's really important for the executive teams as well as your line managers to understand that as the process goes through. And the second is to take a really thorough look at your technology and how it is going to support your combined company's strategic goals. I've seen more times than I can count companies who choose not to remove certain pieces of technology, and it really hampers their ability to perform once they're merged.
What sort of challenges, other than what you just referred to, are going to present itself as we, as payers and providers, try to find better ways to work together or alongside each other?
Sure. You know, there's a lot of, there's decades literally of mistrust, if you will, between payers and providers, and it's going to take a while for that to sort of work through. But we're seeing some evidence of that. I would also say that as we think about merger activity and we think about combinations between payers and providers, the classic change management and physician engagement are really important. Everybody needs to understand why this is happening and how it's going to affect them, and the tools that are going to be available to them so that they're able to do their job.
Are there certain combinations that you've seen work really well?
You know, there are examples of successful payer and providers. We call them payviders. You know, they run from the integrated model like Kaiser, and then they also go to other health systems that have decided to diversify their revenue streams by coming out with either branded exchange health plans or more commonly Medicare Advantage health plans.
Okay. What are some of the messages, final messages that you'd like to leave with attendees? I know that you have a booth downstairs and you're really trying to get the message out there.
Yeah. So we're excited to be here. EPAM is we've been in the healthcare industry for a long time. A lot of places haven't heard of us, but we're trying to change that. Our expertise in technology and engineering is, I would say, second to none, and we're excited to tell you about what we can do and the experience that we have.
Okay, and how are you enjoying the conference so far?
I love it. It's fantastic. I've thoroughly enjoyed the speakers and connecting with everybody here.
All right. Thank you so much for your time today.
Thank you, Mabel. I appreciate it.
And thank you for tuning in. Stay with us.